where got tempers flaring and people produced weapons and started shooting. So it ended up being a lot of people that was all. And what was crazy is it's not always as cut and dry as coming and finding 10 people shot. In that case, there was, 911 was called for hearing gunshots. People arrived. There was 2 people that were shot there. 2 or 3 went home, because they didn't know what to do, and their mom called 911. A couple, people go transfer. About 70% of our mass casualty patients have a high likelihood of going to the hospital on their own. So if they just show up at the hospital, we don't get to see them at all. So, well, without further ado, I feel like I'm not looking enough over at you guys. What tends to be people's favorite thing is going up in the ladder bucket. So anybody that wants to, and I encourage you, please, to muster up all of your bravery and whatever it takes to be able to do it, because it's such an experience that no one, like you guys and us, are the only people that get to do this. And if you don't take advantage of it, I'll just feel some type of way about you. I'll feel sad. I'll feel, I may be mad at you. I may come behind you and hold a grudge against you. But we're going to make sure everybody that wants to has a chance to do that. Then the truck that we take to our mass casualty events is called the SRU or the MAB. There's one here, there's one in Atlanta, the city of Atlanta, away from the people who are more seriously injured. And then we'll ask, is there anybody that can hear me and feels okay but needs assistance? So maybe you broke a leg, if you got shot in the knee, and it's not that bad, we'll come help you. And then the remaining people are the people that we're sorting through to determine if they're going to make it, if we need to make them red, which is the worst case scenario, a yellow, which is the next worst, or a green, which is we think you're probably going to survive, but you still need some sort of intervention. So if you remember that, the SALT acronym: sort, assess, life-saving interventions, and then treat and triage. I'll send your instructors a link that you can use to get a coach certificate. Right now, I'm going to pass this around. When I said life-saving interventions, I'm going to start this at the interventions that we deploy or use on a SANE are almost always going to be a chest seal or a tourniquet. So if somebody actually needs the investment of hands and EMS that would be required to start an IV, give you medicine, breathe for you, we don't oftentimes have the resources to allocate to a single person. So we do real quick, simple, and life-saving interventions, such as the cat tourniquet or the suction